Good afternoon, everyone. This is Danielle Herbert from Way to Go, Connecticut, and I am going to talk to you about navigating transportation options. I want to state that this information is as good as today. So I want to let you know who we are. Uh, I actually work for a program, and Way to Go is overseen by North Central Regional Mental Health Board. I've been here about 18 years almost, and our agency has been around 43 years. And we are state statute mandated to evaluate state-funded mental health services. So, over the past 43 years, we have gone into state-funded facilities, and we will evaluate a program or a system of care. We'll talk to the people receiving services, staff, family members, friends, concerned citizens, clergy, whoever wants to speak to us, police, and we'll write a report and we'll send it to the head of the agency. We'll send it to the Commissioner of Mental Health and Addiction Services and to the Governor's Office, and with our recommendations. And they usually do take our recommendations and make changes in the system of care. What we have found over the last 43 years is that transportation is a major barrier for people with disabilities to get to services. So that's why we went out and got this grant, and it is funded by the Federal Transit Administration. It's a 5310 FTA grant, and it's overseen by the Connecticut Department of Transportation. Mobility management is pretty new around the country. Oh boy, less than 10 years old. And it's a strategic approach to managing transportation resources. If managing a vital community or public transportation system does involve more than operations. It does require regular strategic outreach to the community and those in leadership positions. So I just want to say, if it is new, if you went to look for a job for mobility management, you probably find a job at the AT&T store selling cell phones. It is new. So what it is it does vary. So it varies from transportation planning to making travel arrangements to overall coordination of human service and general public transportation services to what I'm doing. And what I feel, it's about moving people instead of moving vehicles and focusing on the individual's needs, their distinct travel needs of that individual consumer. It's about cultivating partnerships with transportation providers and municipalities and agencies, and offering a single point of access for customers with multiple transportation modes, and improving information about transportation via outreach. Our mission is to promote the coordination and marketing of all the transportation options available in North Central Connecticut. It is to identify gaps and barriers in services, transportation services, and we've created like a one-stop shop where individuals can find solutions to these transportation challenges. I do work with many human service and transit providers. So on the human service side, the nonprofits, the area agencies on aging, the community action agencies, workforce development, governmental agencies, hospitals, nursing homes, well, not nursing homes per se, I'm sorry. I meant to say independent living facilities. And then with the public fixed route providers, the private agencies and providers, paratransit, and the state with non-emergency medical transportation. there are benefits for having a mobility provider working with transportation professionals. We do develop new relationships. We collaborate on grant programs and support new mobility management practices such as volunteer driver programs, shared ride programs, public and paratransit transportation. There is an impact on transportation if there are barriers. And so if people can't get to their appointments, they miss a medical appointment, it interrupts the delivery of care, they have an inability to comply with prescribed health care management plans, and then they have difficulty making and keeping follow-up appointments. It leads to poor health outcomes, and it does increase use of emergency room care. So it is very, very important. We do promote services with all of these different providers and agencies. Most of our activities are outside of the home, and as I said, access to preventative and follow-up care is very important. A more mobile workforce with access to job training and job sites, very important. Higher quality of life with independent travel, work, shopping, and social events, that affects our economy. It has economic implications. Social events, that people go into depression if they don't see their family and friends. So if people can't get to the agencies, they can't access services. The agencies can't fulfill their mission to provide life-enhancing services. So once again, it does impact the community at large. And this information is data from the Coordinating Council on Access and Mobility. Limited mobility can have a significant impact on health and social outcomes. So compared with those who still drive, older non-drivers make 15% fewer trips to the doctor, 59% fewer shopping trips and visits to restaurants, 65% fewer trips for social, family, and religious activities, and 82% of Americans age 65 or older worry that they'll be stranded and they won't be able to get around when they can't drive. So here in the state, the mobility managers are also transportation or mobility ombudsmen. So what we do is we represent the interests and we act as an advocate for individuals who do have issues with mobility. So if they have problems, give us a call. We do once again identify gaps and barriers in services. We have a call center here at Way to Go, Connecticut with language line translators. So you can call in Monday through Friday, regular work hours, and within a few moments, if a language line translator is needed, we can get a translator on the phone. We have a steering committee that does help with program focus, and members on that committee are people from public transportation, paratransit transportation, Area Agency on Aging, Developmental Disabilities, Department of Aging, non-emergency medical transportation from DSS, consumers who take public transportation, and paratransit transportation. And they all do help with program focus. And we do a lot of customized outreach. So I'm out on a regular basis at forums, speaking at forums, at senior centers, housing authorities, homeless shelters, speaking to disability commissions or commissions on aging, speak to human service staff, discharge staff, senior and health fairs, support groups. I do have these touchscreen transportation kiosks at different locations. Been on radio. The program has been featured in newsprint and television. And we do have our website and this webinar, my first, which is geared towards the provider. So the entire state of Connecticut is covered by mobility management. Once again, I'm Danielle Herbert, and I do cover 37 towns in north central Connecticut. And these are the towns I cover. Down in the southeast part of the state, Rick Davis from the Kennedy Center runs knowhowtogo.ct.org, and these are the towns that he covers. Down in New Haven County, so South Central Connecticut, we have knowhowtogo.sct.org. That's Know How to Go South Central Connecticut. And these are the towns that the mobility manager, John Ordzala, covers. On the eastern part of the state, the Eastern Connecticut Transportation Consortium has a mobility manager, and they're a little different than the three that I've just mentioned, my program and the Know How to Goes, because they're more rural areas. So ECTC, Eastern Connecticut Transportation Consortium, had to get creative with the money that they received. They need to reach the most people possible. So one of the ways they do this is by being a broker for part of the transportation on the programs they provide. Their Dial-A-Ride program is in-house. They take the phone calls, they schedule the trips, and transport the clients. They'll take clients on medical trips in southeastern Connecticut to Basra, East Lyme, Griswold, Groton, Ledyard, Lisbon, New London, North Stonington, Preston, Salem, Stonington, and Waterford. 70% of seniors over the age of 70 have a disability. So ECTC has opened up their half-price taxi and livery voucher program to people living with a disability for all who live in East Hartford, all people with disabilities who live in Eastern Connecticut. And I will talk later about the half-price taxi program. They have a Rides for Job program, and this helps people continue or get back to work. So they provide transportation to the American Job Center for employment workshops and trainings and job interviews. And once they start working, they can provide 1 to 3 months of transportation until they get established. They have this card-based solution, so income-eligible clients can receive funds to cover up to 90% or a vehicle repair of up to $1,000. And they also pay for a client to get a license so they can go back to work. And they do encourage case managers to encourage the clients to seek employment on a bus line or in their town where a rideshare program might exist. So they use multiple types of transport services using the most effective source. And our newest mobility management program is in the western part of the state. And these are the towns that this program covers. It is a relatively new program. It is a rural area. They have different challenges there. I'm North Central Connecticut, and I have a more urbanized area, so I have different challenges. But this is a new program, so not a lot is in place at this point. But they are working on it. So I just want to show you our website. It's waytogoct.org. And let me go live to the website. So this is the website. I'm very proud of it because I've just changed the website in the last year. So this is 100% screen readable for people with vision impairments. You can take the graphics away if it's easier for people to read. Let me just clarify. People with vision impairments, these screen reader programs will read verbatim exactly what is on the page, where a lot of websites, it's very fragmented and the blind cannot access them easily. So as I said, you can take the graphics away. You can increase the font. You can make it black and white if that's easier for somebody to see. You can inverse the colors if it's easier for someone to see. It is translatable with Google Translate. So we'll just go to Spanish here. And all the information is available in all of these languages. So basically what you do is you'll just go to a town that you're interested in. So we'll go to West Hartford. It's all set up the same. So you'll just click on the tab and you'll get the information by the provider, the area that it's served, website links. It has, for public transportation, all the local bus routes, hours of operation, and costs. So you can see all this information. Any eligibility requirements, all that information. So this is each town. Each town has its own page with information specific just for that town. Okay, back to the show. I also have a resource guide for people, a paper resource guide for people who do not have access to the internet, because many older adults and some people with disabilities do not have that access. So the information is set up. Let's see if I can get this to work now. In the front of the book is all the information that I'm going to be talking to you about today. And then in the back of the book, it's specific for that particular town. So once again, it will have the information listed by the provider, the area served, the type of service, website links, any additional information or qualifications, telephone numbers, hours of operations and operation and costs. I feel that when I do go out to all these senior centers and housing authorities that they do not have access. So that's why I've created books for each town. So let's start talking about transportation options now. We're going to start with public transportation. And there are, well, with Connecticut Transit, there are 265 local and express routes, and it does have access to the CT Fast Track. All of the Connecticut Transit buses have wheelchair lifts and ramps for access by people with disabilities. The CT Fast Track has level boarding, so there are no wheelchair lift and ramps. You'll just level boarding, roll right on. They all do have bike racks. CT Fast Track, you can roll your bike right onto the Fast Track, right onto the bus. The express buses have Wi-Fi, and so does CT Fast Track. The buses now have a GPS vehicle location, and it should be on all of the buses by now, but I'm not sure if it's 100%, but it's pretty close. So what that is for Connecticut Transit to keep track of the vehicles, to make sure that they're on schedule. Also, there are applications like Google Transit or the Transit app, and it will tell people if the bus has already arrived or if the bus is on the way. I wanted to let you know that they do offer a reduced fare program, so it's half price for older adults over the age of 65 or somebody with a disability. So you pay $5 and you get this card. But people can use their Medicare card. I would not recommend that because that does have your Social Security number on it. But Connecticut Transit does have these half-price cards. So we have also CT Fast Track, which is a couple of years old now, about 2.5 years old. It's a bus rapid transit system. So if you don't know what that is, it's actually, they have these around the world. They're all extremely popular, and CT Fast Track is as well. Back within the first 6 months, I think they surpassed 2020 totals. They've had probably, at this point, 7 million riders or more. So basically, the way I like to talk about it is a dedicated road just for the bus. And it does have circulator lines, which go on the regular streets. So I want you to think of this as like the T in Boston or a subway line, okay? But this is just for the bus. So it starts in Bristol, Cheshire. They have you can start in Cheshire or Southington. Brings you into the New Britain station, where you can make connections. You can go to Waterbury, and from Waterbury you can get on Metro North. And then it goes into downtown Hartford, where you can make many connections. But I want you to, this dedicated road, I want you to think of this as your spine. And I want you to think of these stations as your ribs. These stations have circulator bus routes. And you might have seen these green CT fast track buses on the road, on the regular streets. That's because at some point they will connect with the CT fast track system. So CT Fast Track East was a plan. It's on hold for a bit right now because, you know, our state is in deficit. So we're waiting to see, they're waiting to see what's going to happen with that. But they will in mid-August be starting a stores line. So it was part of the CT Fast Track East study. And by the way, that CT Fast Track East was going to go from Hartford to stores using the HOV lanes on I-84. And then it would have circulator lines in the different towns. Well, as I said, that's on hold for now, but they are keeping the route going to stores. So it's going to be the stores Hartford Express, and it's going to begin August 15th. And as I said, it was developed as part of the CT Fast Track East study, but it is not the CT Fast Track East. And their proposed schedule is hourly service from 6 a.m. to midnight, and weekends as well, but with a shorter schedule, and on Sunday a short schedule. The Burnside Avenue and Silver Lane corridors have been identified as priority for on-street bus rapid transit when they do implement the CT Fast Track East. So I told you that there are circulator lines. Those are those green buses that you see on the road. The blue buses are the local bus, local fixed route bus for CT transit. CT Fast Track, the green. Okay, it connects to the CT Fast Track system. These circulator lines go into Plainville and to Bristol. It goes to Manchester Community College, Yukon Health Center, Silver Lane, Main Street, Connecticut Boulevard. It goes to West Farms Mall. It has stations. It goes on Stanley Street in New Britain down to the New Britain station. There is a CCSU shuttle. It goes into Cedar Street station and right into the campus. It also serves Fenn Road and the Newington Junction station. There's a Wethersfield West Farms route, Route 144, which goes through Newington Center and to Brittany Farms, and it does go to the base of the Silas Deane Highway on Jordan Lane in Wethersfield. There is one that goes through West Hartford, so Flatbush, off of Flatbush Avenue Station, you can transfer to 153, and that will take you into West Hartford Center. And it will take you to Bishop's Corner in West Hartford, and then to Cottage Grove Road, where it will go to Cigna and MetLife, and then over to the Capaco Shopping Center. And there is a circulator that you can connect to from the Sigourney Street station, which will take you to St. Francis Hospital, Hartford Hospital, and Woodland Street, all those streets around there and around the state capitol. They also have a Hartford Dash that you can connect to, where you can get a free circulator around the city of Hartford, the downtown city. I wanted to mention to you that it does also stop at Union Station, so people can make connections at Union Station in Hartford. Okay, so in January, and this is on schedule, January 2018, there is CT Rail coming, and that is a commuter rail line, kind of like the T in Boston. So they're using existing track, and they've added track, some existing Amtrak track, and they're adding track to make a commuter rail that's going to start in New Haven and go up to Springfield. From New Haven, you can get onto Metro North or Shoreline East. Once again, and from Springfield, you can get up to Brattleboro Brattleboro, Vermont, or you can go to Boston. Once again, I want you to think of this as your spine, and these stations along the way as your ribs. These stations in the future may have circulator lines. It's in process of planning, but public transportation circulator lines meeting them. The state Department of Transportation is trying to create a web of transportation to make people get around much easier, and they are doing it. So let's just look at this. I told you it starts in New Haven. There's a couple of stations in New Haven. There's one in North Haven, in Wallingford, in Meriden, in Berlin, in Newington. Now from Newington you can connect to the CT Fast Track in West Hartford. It will stop at Union Station, and you can make transfers to the bus system or the Amtrak system there as well. Windsor Locks, they will have a shuttle going to the airport, Enfield, and then ending up in Springfield, where you can make those connections to Brattleboro or Boston. I told you that the buses do have GPS, and that is used for, as I said, to keep them on schedule, and for the transit app, which you need a smartphone, but it will plan your trip, and it will tell you how far the bus is. You can go on to CT Transit's website and plan a trip that way. You can call CT Transit, and they can walk you through it. They can send it to you in the mail. They can email you an itinerary, just like the old AAA triptychs. You can also call 24/7 to 211, and they would be happy to help plan a trip for someone on public transportation. And then there's Google Transit, where that will also plan the trip for you as well. So another part of transportation is, maybe you've seen these logos up here, up at the top, these white little mini buses, Greater Hartford Transit District, okay? That is public transportation. It is public transportation for people who are unable to use the regular public transportation system. So the Americans with Disabilities Act did mandate that paratransit services need to be available for residents during the same hours of operations as an existing fixed bus route. And so it does grant equal access and not more access for people. So if there is service, well, let me just tell you this. We're going to skip to the next one, and then we'll go back. This is a map of their service area, okay, of Greater Hartford Transit District's service area. So it will pick up people with disabilities at their home or a location within 3/4 of a mile of a fixed route bus. So these lines here are bus routes. And you'll see it will go down here into Meriden. It goes 3/4 of a mile on this particular route to the east and 3/4 of a mile to the west. Some areas are completely covered because there is public transportation throughout that entire town. And you can make connections. So say somebody wanted to get to New Haven. They would be dropped off at either at the McDonald's or the Mid-State Hospital in Meriden, and then the Greater New Haven Transit District would pick them up. It does not work with express bus routes. It only works with Connecticut Transit fixed route bus routes, okay? So it's curb-to-curb service. It is on a reservation basis, and I told you it does run the same hours and days as a fixed route service. So if that bus route runs, for example, Monday through Friday from 6 a.m. in the morning till 10 at night, that's when paratransit service would run. If it runs on Saturday from 10 in the morning till 6 at night, that's when paratransit service would run in that area. And for example, if there is no service, local bus service on a Sunday, then there is no paratransit on that day. So an individual has to fill out an application, and they must have a disability that does impair their ability to use the fixed route bus system. So either a cognitive, physical, psychiatric, seizure disorder, or vision disorder. There are applications available online at www.ctada.gov. And basically, you fill out the information. There's questions they ask. You answer them. You give the doctor's name, and then they will come and pick the person up at their home. Make notes about how they're picking them up, what entrance, and then they will bring them into either their Hartford location or in New Britain at the New Britain Senior Center to interview them. Once they are interviewed and once that happens, they can have this service. Now, this service can be conditional. This service could be permanent, okay? It could be temporary, or it could be conditional. So permanent means permanent. Temporary is if, say somebody had a knee replacement and they are unable to get to the bus to maybe follow directions, it's uneven pavement. There are many, many things that go into consideration that maybe a person wouldn't be able to get to the bus and take the bus. So somebody has a knee replacement. They can't get to the bus. They can't use the system. They can have temporary service. There is conditional service. So say in the middle of the winter, somebody has a vision disorder. They cannot see at night, and it gets dark at 4:15 at night. So they would have that service just for that period of time when it's dark. Also, when they get this service, they can utilize the Freedom Ride program. So I did tell you with ECTC on the eastern part of Connecticut, they have a taxi voucher program for people with over 70 or with a disability. So it's half-price taxi. Well, here in north central Connecticut, we have it as well. It is also available with Metro Taxi down in the New Haven area and down in the Fairfield County. So what this is a half-price taxi voucher program. They call it the New Freedom program. Let's get to that. So here in this area, basically what you'll do is you'll fill out an application once you've been approved with the ADA for paratransit services, and you initially give a $25, you write a check for $25. They will send you a card with $50 on it, either for Yellow Cab or Executive 2000. The rides must begin or end. It doesn't have to begin and end in those towns, but begin or end in the towns listed here. So if somebody is in Berlin, they could actually go to New Haven if they wanted to. It just has to begin in Berlin. They can make connections to other Freedom Ride programs, but they can't double dip. So you give your $25 initially. You can give up to $50. So the $25, they'll send you a $50 card. You call the cab company 24/7. They pick you up. They swipe your card, and say your ride's $10. They'll take $10 off your card. So, but it's really only costing you $5. You can't double dip, as I said, so one month you pay, say, Yellow Cab. The next month you can pay Executive 2000 if you know you're going to need rides down in that area, or Metro Taxi to make connections. I wanted to talk to you about travel training. So the Kennedy Center is one of the largest nonprofits in the state, and they have a travel training program, which they actually do go to different states and train people on it. So the mission is to teach individuals with disabilities and older adults how to travel safely using the public transportation system. So it could be a bus, down at the shore, it could be Metro North or Shoreline East, and they're going to have to expand in January when CT Rail comes, because it does teach people how to use the regular bus. It teaches them about the rules of the bus, teaches them routes, what to do if there's an emergency, if they miss their bus, if they miss their stop, if they feel unsafe. And they work with the trainee until they are ready to travel independently. So you would just call and, they will communicate with the referral source, not sauce, and keep them updated with the trainee's progress. So basically, what you're going to do is you will call and complete a referral form, and then they'll schedule an intake with an assigned travel trainer, and they will discuss where the people want to go, and then they'll establish the schedule for travel training. They will meet the person at the bus stop and take them on that route as many times as it takes for them to feel comfortable in taking that route. They will receive a 1, 3, 6, and 12-month follow-up. They will follow the bus to make sure that that individual, if that person is making a transfer or getting off at a certain stop, to make sure that they get off on the right stop or make the correct transfer. And once they are travel trained on that route, they can choose a new destination. There is no cost for this program. However, they are asked to pay their bus fare. And you can call the Director of Mobility Services at the Kennedy Center to make arrangements for this. And his number is listed and email below. We're going to talk about alternative transportation providers. So there are alternative transportation providers. There might not be one in your area, but let me go over them for you. So if you have AIDS or are HIV positive, AIDS Connecticut and Latino Community Services, and you do not need to be Latino, will provide rides, medical rides, to individuals for services for HIV or AIDS-related appointments. The National Connecticut chapter of the National Multiple Sclerosis Society will either give a reimbursement in travel, or they will pay for, I think, a couple of rides a year. ALS Connecticut for Lou Gehrig's disease, they will give rides on a limited basis. FISH, Friends in Service Here, that is located in South Windsor and Glastonbury. They are a group of volunteers that will give rides to older adults for whatever reason. They are not wheelchair accessible. Senior Job Bank is in West Hartford. They do cover a few towns in around the Hartford area. Basically, that is a database. So say I wanted to get a job, and I have to be over 50 years old. I wanted to get a part-time job typing for someone, or mowing their lawn, or cleaning their house, or driving them, being a driver. I would register with the Senior Job Bank. They would do a background check on me, and then somebody would call in and say, hey, I need somebody to give me a ride. They would connect you with that person. You would make arrangements with them for costs. Sometimes individuals won't charge, or they charge a very low amount. They usually do not take wheelchairs. Nutmeg Senior Rides and ITN Central Connecticut are two nonprofit agencies. So let's talk about Nutmeg Senior Rides. They have volunteer and paid drivers. They do run 365 days a year, 24 hours a day. Basically, there is an annual membership fee of $40, and they charge a ride fee. So up to 2 miles, and it's on a scale. It's $5 each way. 3 to 5 miles, it's $10. 6 to 7, it's $14. 8 to 13, it's $19 each way. And over 14 miles, it's $25 each way. Now, this is not curb-to-curb service like the paratransit I was talking about. This is arm-through-arm and door-to-door service. So that person will go up to the door, ring the doorbell, help the person down, get them in the car. They do not take wheelchairs, however. And they do run in Bloomfield, East Granby, East Windsor, Enfield, Granby, Somers, South Windsor, Windsor, and Windsor Locks. But they do take people cross borders into other towns. It is a 501c3 nonprofit agency. ITN Central, and they do work with older adults over the age of 50, if you call that an older adult, and people with vision impairments. ITN Central Connecticut is also a nonprofit agency, and they work with older adults and people with disabilities as well. I think you have to be 62 or older with ITN, and they run in Avon, so it's kind of the same type of program. They do charge a fee of $40 for an individual or $65 for a family. And then they have a sliding scale as well. They do cover 15 towns: Avon, Cromwell, Durham, East Haddam, East Hampton, Farmington, Haddam, Hartford, Middlefield, Middletown, Newington, Portland, Rocky Hill, West Hartford, and Wethersfield. And they're another great organization. I really think they're wonderful organizations. Now, they're also looking for volunteer drivers. So if you know of anyone who wants to be a volunteer driver, please get in contact with them. Also, you can bank, so say you know somebody who's driving, who's going to be, they're going to be giving up their vehicle in the next few years. Maybe they want to do some volunteer work. They can bank hours, like ride hours, with both of these organizations. So in the future, when they're not driving, they'll have these credits. You can buy gift cards. So if there's a parent, a child who wants to give a gift card to a parent to use, you can do that. You can donate a vehicle. You donate a vehicle. If the vehicle's worth $1,000, you get $1,000 worth of rides. If the vehicle's worth $5,000, you'll get $5,000 worth of rides. So I think that's a pretty good thing. RSVP is a volunteer organization, and they do not charge for rides. They actually run in Southington, New Britain, and Berlin, and they supplement the dial-a-ride systems in those towns. And those are free rides. Neighbor Brigade is in Southington and in Suffield, and that's a volunteer organization as well. American Cancer Society will give rides, free rides to people for cancer-related treatments. You can always call your Rotary Club or your Lions Club to see if there are volunteers there. There are, of course, private pay. One is Seniors Helping Seniors. And I always say if the individual belongs to a church or a temple, to call the clergy there, to call the secretary, and ask if there are any volunteers that would be willing to give rides. You would be surprised, especially in rural areas, how many people have gotten rides this way. If somebody's receiving services through the VA does have their own system of transportation. They have a shuttle bus that runs in New Britain, Hartford, and East Hartford that will pick up people and bring them to the VA in Newington. They have disabled American veterans, which will pick up people and take them to the VA as well. They do have their own system of transportation, as I said, that runs down to North Haven, will run to the state in Rocky Hill, the state VA, and say somebody needs services, a treatment in Poughkeepsie, New York. They will actually transport them to Poughkeepsie, New York. The VA does have their own transportation department and mobility manager. And they will also reimburse people for travel. So there are qualifications. The individual, the vet needs to be 30% disabled, but they will give they will give mileage reimbursement. So say their friend is driving them to an appointment, they can get reimbursed for that. So Dial-A-Ride, and I hope I'm getting some snickers out there about my Dial-A-Ride because I think that's pretty funny. But each town, oh, let's go back. So not every town in the state does have a Dial-A-Ride system. They are run by the local town, the municipalities, and they all have different age requirements, different hours of operations, different costs. And so you can go on my website, www.waytogoct.org, and click on the Dial-A-Ride button for that particular town, and it will give you all the specific information about that program. Non-emergency medical transportation. So that is for people on Medicaid, on Husky A, C, or D. And they do give same-day service if necessary. They will reimburse for travel. They will give bus vouchers. Right now, the provider is Logisticare, and their contract does end on December 31st, 2017. And you can call the number at the top for reservations. There is a Where's My Ride line, so individuals can call if their vehicle isn't on time to see where that vehicle is. There have been many problems with the way this has been running for the last couple of years, and so there is a new provider, which I'll talk about in a moment. But at this point, there is a facility services website for providers, and that is the address. And case management support, specific website to download forms. And by the way, members can make reservations on the phone, online, and everything can be done as well on their website. So as of January 1st, 2018, there is a new non-emergency DSS transportation provider, and that is Veyo. And I'm going to show you a short video on Veyo. Let's get back to Veyo. Okay. Just want to make sure the volume's turned up. All right, let's see. guess people want to get me on Facebook. I don't know how that went on there. Whoops. Okay, from current slide. So Veo is going to be running like like Uber in a way, or Lyft. So there's also rideshare available in the state. CT Rides will help people plan trips through Connecticut Transit, as I said. They also will hook people up for van pools and carpools. You can also go on the internet to e-rideshare, New Ride, V-Ride, or carpoolworld.com. And there are car share vehicles. So there are vehicles located here in Connecticut in this area at Bradley International Airport, Trinity College, and the University of Hartford. In New York City and Boston, there are hundreds of these vehicles. But Zipcar, basically it is a membership program. So you sign up, you pay a membership fee, and you can rent a car for an hour or a couple of hours. They have an hourly rate. All the gas is included, all the insurance is included, and it runs about $8.50 an hour. Now in New York City, you can get a Rolls Royce at $500 an hour, but here this is what we have. It's pretty good. So the transportation network companies like Uber and Lyft are here in Connecticut. I wanted to mention a couple of different options because you need a smartphone or a computer in order to call a ride. There's really not a telephone number you can call like a cab company and get a ride. So they've created Uber Central, and Uber Central is, we use Uber Central here for our volunteers and to get people to meetings. Uber Central is used by a lot of hotels and a lot of assisted living facilities. So basically the person would sign up with Uber, and you can get up to $20 off your first ride if you sign up with the code Way2Go CT. And that would have to be used in one ride, just to let you know, but you can sign people up for Uber and then make the reservations for them with Uber Central. So they won't need a smartphone, and then bill them at the end of the month. Now, maybe you don't want to do that. So there's a new service. It's a concierge service. It is called GoGo Grandparent. And GoGo Grandparent, basically, it helps, well, it's for people without smartphones or computers. So basically what they'll do is they'll call a toll-free number, and once they sign up with them, they'll give them, and they'll have them sign up with Uber and Lyft. Then if somebody wants a ride, they call the toll-free number, and they'll be prompted. Press 1 to get I have a car pick you up at your home. Press 2 for a car to pick you up where you were last dropped off. And then it will have custom locations. Press 3, 4, or 5 for the car to pick you up at a custom location, or press 0 to talk to an operator. It is available in this area. They do charge for it, so they charge the Uber fare, the base fare, plus $1 a mile, plus 10 cents a minute, with a minimum fare of $5.80. And then GoGo Grandparent has a concierge fee of 19 cents per minute. But it does work for people who don't have smartphones. I think it's wonderful. WalkScore. I just wanted to mention WalkScore. WalkScore.com. I'm going to hop over to the internet again. Excuse me. Sorry about that. Too much talking here. So, WalkScore will tell you if you live in an area that is walkable or that there's public transportation around. I had a person call me once from somebody not even in my service area. I think it was Amston, Connecticut, and he was blind. And he said, "Where's transportation for me?" And I said, "I'm sorry, there's really no transportation for you." He said, "I just moved here and I have no transportation." And I said, "As soon as you can move, please call me, because I will find a place for you that is near public transportation. Because where there is public transportation, there is always other transportation. And there's paratransit transportation, as I said, that 3/4 of a mile corridor." So, I'm just going to give you a couple examples of this walk score. I'm going to put in my work address. It will come up with a map and it will tell you how walkable that is, what type of transit is around. It's pretty good, right? Let's go to an address in Ellington. And I'm sorry, Ellington, I took your housing authority as an example. Their walk score is 36. You have to be car dependent, basically, to get to anywhere. So if there are people helping people with housing to find a location, please put them near public transportation and use walk score. There's a program that's in development, and it's from the Connecticut Center for Advanced Technologies. And it is a tool that will identify employers with job openings, and it will display specific bus routes and walking directions. The initial thought behind the creation of Job Track Connecticut stemmed in the need to support job seekers who express the necessity to work in close proximity to a bus line. And the issue came in identifying specific job openings. So currently in this area, there's no resource for a job seeker to identify, and this is for manufacturing jobs on a bus line, without knowing the specific manufacturer, the company name, and the address. And Central Connecticut does have a robust manufacturing industry, and much of it is along the Hartford, New Britain, Waterbury corridor. And it is accessible via public transportation and the circulator routes that link to the CT Fast Track. So when this is implemented, and as I said, it is in development, it will allow people to find job openings and then find the transportation to see if it will work for them, and link them to those manufacturers so they can fill out applications. I think it's a wonderful thing. Okay, so I am on Facebook and on Twitter. So I have, well over 700 likes on Facebook now. I'm really more on Facebook than on Twitter. I do put a couple of whenever I see something that's relevant, so maybe once or twice a day, I'll put it up on Facebook. And maybe it will have a survey, which I have on now, that Connecticut Transit has a survey on ridership. Maybe it's about what's going on in transportation with the state legislature. Maybe it's a cute little video about transportation, or it's about a delay in service on the bus line. Or a detour, whatever it may be. I will put it on facebook.com/waytogocT. So you might be confused. I know I did give you a lot of information, but we are a free resource. We're your one-stop shop for transportation information. We do provide ombudsman services, do a lot of outreach, so if you're in need of that, please contact us here at 860-667-6207 or info@waytogocT.org. The website is available, and we've had, oh gosh, maybe 140,000 visits with a very impressive return rate. I'm very happy about that. We'll go out to staff with that outreach and speak to your staff. We'll go out to disability groups, webinars, and the social media updates. And I did give you my number, but there's my number and email address again, and the information for the other mobility managers in the state. So I do thank you. I wonder if you have any questions. Let me see if there are any questions. Okay, I do have a question. Is travel training statewide? Travel training is wherever there is public transportation. So in some parts of the state there's no public transportation, so no need for travel training. So the local bus routes, the local commuter rail, the Shoreline East, Metro North, and then when we do have our CT rail, it will be along that corridor. Okay, another question. Is RSVP available for people with disabilities? Well, no, they do not take wheelchairs unless that person is able to transfer on their own. It is a free service, as I think I said, but they will not take somebody who is in a mobility device that cannot transfer. Any other questions? I know I gave you a lot of information. Okay, so please give us a call, any one of us in your area, the other mobility managers or myself, and we would be happy to talk to you at any time. So that is it, and I am very happy that you were able to join me, and thank you so much, and have a great day. Bye-bye.